Patient is in good condition. Patient has been here since Monday. We began preparing for the novel coronavirus on Saturday. We started receiving messages from the CDC Saturday, and we began to distribute those to our chief medical officers, who passed them on to our emergency room physicians. Our staff was incredibly well prepared. We were expecting that eventually the virus would hit the United States, although we weren't expecting it to hit this quickly. Patient arrived on Monday evening, and the patient was appropriately treated. Patient had a mask placed and was asked the appropriate screening questions, and we determined that there was a history that the patient had traveled through the Wuhan region of China. Patient was placed into isolation, and we called the local departments of health to take appropriate action. Throughout this entire episode, we've been working very, very closely with the CDC and the state and local departments of health. The patient had appropriate cultures drawn, and those were sent by the IDPH down to Atlanta to the CDC, where they were tested.
We're going to continue for her to be in isolation now until we are quite sure that she's no longer communicable. She's still symptomatic but improving. She had cold-like symptoms, shortness of breath, fever, and many times it would present just like a cold, just like a cold or flu. And she came to the hospital, I believe, because her attending physician was on staff and sent the patient to the hospital.